Okay, guys, it's me again, and we're going to be looking here at the skull. So let's go over here and look at the skull, but we're going to first open up the top. So this is the cranium, right? We're going to open the top, and we're going to have, there you go, the cerebrum. The cerebrum is the brain, okay? It's the top part of the brain. We dump out the brains here, and this is what we got. We're going to go over this really quick. My cat's coming over, so we're going to be disrupted in about 15 seconds. This is the brain, okay? It weighs about 3 pounds. It's like the texture of tofu. It's about that, like, if you lifted a bunch of tofu, it would feel about the same. It's a gushy kind of thing. About 70% of it's water. 50% of this is fat. But we're going to talk today about the different parts of the brain. As you can see, there's vessels on the outside. There's no nerves that feel pain on the brain. That's why they do brain surgery when you're awake. And they just cut a little hole in your head called trepanation, and they dig around in there and fool around and poke things and make you say weird stuff and whatnot. But we want to talk about a few of the parts of the brain. Here's the different parts of the brain. First, we have a right and left hemisphere. This is the right side, this is the left side. If we split it apart, I think I can do this without tearing it to shreds, probably. There we go. It's always hard to come apart. We have right and left hemisphere. Here we go. So we're going to put one side down because we're only going to need to really work at one. On the outside of the brain, the frontal lobe is here. The parietal lobe is up here. Frontal lobe is for higher thinking and planning. Parietal lobe is some of your motor and sensory information that you would to move and to feel things. Down and through here's the temporal lobe. This is for hearing mostly and some speech stuff. Back here is the occipital lobe. So there's our 4 lobes. 1, 2, 3, 4. Now inside here is called the insula because it's insulated. It's another whole part of the brain. We'll get into that later. Also, we want to look at the surface of the brain and see these little indents. Those are called sulcus or sulci if they're plural. A sulcus is one, sulci are many. And then we look over here on the lumpy bumps up on the top here, and those are called gyrus or gyri, okay? Turn the brain on the inside. This is a lateral view. Whoopsie. This is a sagittal or lateral view. Put our little cerebellum back. I'll get to that in a minute. This is a lateral view or a sagittal cut this way. Remember, sagittal this way. And we look at the lateral side. If we take our brain and we look also at this lower part, this down here is the cerebellum. This is what helps you with proprioception and able to know where your hands and feet are without even looking at them. Down here, this is the brain stem, okay? And we turn it all around. The connector between the right and left hemispheres is this through here. This is called the corpus callosum. Corpus means body, and callosum means just, corpus. Yeah, corpus callosum. Callosum just means like callus-like. It's harder. It's kind of like if you ever chopped up, it kind of looks like cauliflower in an odd way. Brain really looks similar to cauliflower, and you see a lot of the same kind of stuff. So if you want to pretend to slice apart brains, get an old cauliflower. This area in here, so this guy here, and all of this through here is the hypothalamus, and then down through this part here, I'm doing this all backwards and inside out for myself, is a pituitary gland. Pituitary gland is a master gland. It does a lot of stuff. And then we get down here through this brain stem. This lumpy bump here is called the pons, and then the medulla oblongata, one of my favorite words. Okay, easy peasy on that. Again, here's the cerebellum. This has to do with balance. Back here, we have the occipital lobe, has to do with sight. Up through this side through here, we have a lot of the, some of the motor and sensory things here, and the planning over in the front. This is the frontal lobe, okay? So that's the super basics. This hole in here, or actually right up here, actually in here too. This hole or space in here is called a ventricle. We'll talk about ventricles another time. But right now I just wanted to get you the 4 lobes plus the other little bits of the brain. Now, if you're going to draw the brain, I like to have you draw it from this side, whatever the outside. So you're going to draw like the parietal lobe, right? The temporal lobe down here. You get the frontal lobe and the occipital lobe here in the back. Don't forget this guy here. It looks like a ball of yarn, and that's the cerebellum. Has to do with balance. And then you can also put in, if you like, the pons and medulla oblongata. Actually, we'll turn it this way so you can see the pons and medulla oblongata. That's the basics of the brain. Your assignment, I think, was to do a drawing of it. So do a drawing, and I want you to label in there as well. Do a little copy drawing of another picture that you find. Frontal lobe, parietal lobe, temporal lobe, occipital lobe, cerebellum, brainstem, Also give me the gyrus and sulcus. Now, if you want to get really in there, you can do some of the other bigger stuff, but right now let's not worry about that. Let's just get the basics, okay? This is Dr. Sean signing off. You guys take care, do good, and we'll see you on the flip side.